When assisting a patient with a weak left side to transfer from bed to chair, the CNA should position the chair on which side? A. Left side, close to the bed. B. Right side, close to the bed. C. Either side, depending on the patient's preference. D. At the foot of the bed. Answer, B. The stronger side should lead during transfers to maximize safety and stability. Placing the chair on the stronger side helps the patient pivot more easily. A CNA notices a resident clenching fists, pacing, and speaking loudly. What is the best first response? A. Call security immediately. B. Approach and calmly acknowledge the resident's feelings. C. Ignore the behavior until it escalates. D. Physically restrain the resident. Answer, B. Early recognition of escalating behavior and calm verbal de-escalation prevent aggression and ensure resident dignity and safety. A resident with a hip fracture has strict non-weight-bearing orders. When providing care, the CNA must A. Encourage light walking to promote mobility. B. Assist the resident to bear weight only with support. C. Never allow the resident to stand on the affected leg. D. Transfer the resident without using assistive devices. Answer, C. Non-weight-bearing means the affected leg must not touch the ground. The CNA should always follow mobility orders to prevent further injury. If a resident refuses a prescribed meal due to cultural restrictions, the CNA's best action is A. Encourage them to eat it anyway. B. Document refusal without telling anyone. C. Inform the nurse and request a culturally appropriate alternative. D. Remove the tray without follow-up. Answer, C. Respecting cultural needs and promptly reporting ensures residents receive appropriate nutrition while honoring personal beliefs. When using a mechanical lift with two caregivers, which step is most important? A. Asking the nurse for permission before each use. B. Locking the lift wheels during the transfer. C. Assigning one caregiver to operate and the other to guide. D. Moving quickly to minimize resident discomfort. Answer, C. One caregiver controls the lift while the other steadies the resident. This teamwork ensures safety and prevents accidents. A resident with Parkinson's disease has difficulty initiating movement. What technique can a CNA use? A. Encourage the resident to move independently. B. Give step-by-step verbal cues or rhythmic prompts. C. Move the resident quickly without explanation. D. Avoid assisting until the nurse arrives. Answer, B. Parkinson's patients benefit from cues such as step, or rhythmic signals that help overcome movement freezing. A CNA is helping a resident who has expressive aphasia. Which communication strategy is most effective? A. Speak loudly and repeat the same sentence. B. Allow extra time and use yes/no or picture boards. C. Correct the resident's words immediately. D. Avoid communication until speech therapy arrives. Answer, B. Aphasia requires patience and supportive tools like simple questions or visual aids to promote effective expression. If a CNA observes another aide using their personal phone to record a resident, the first step should be A. Join in to avoid conflict. B. Report the incident to the charge nurse immediately. C. Ignore the action. D. Confront the aide aggressively in front of the resident. Answer, B. Recording residents violates privacy laws, HIPAA. Reporting to the nurse ensures prompt intervention. A resident with a swallowing disorder is coughing frequently during meals. What is the safest CNA action? A. Offer thin liquids with a straw. B. Encourage fast eating to finish quickly. C. Stop feeding and notify the nurse immediately. D. Tilt the resident's head backward to swallow. Answer, C. Coughing during meals is a sign of aspiration risk. Feeding should stop, and the nurse notified. A CNA notices an unsteady resident attempting to walk alone without their walker. The best immediate action is A. Allow the resident to continue for independence. B. Gently guide them back to safety and provide the walker. C. Call the family to handle the situation. D. Physically block the resident without explanation. Answer: B. Promoting independence is important, but safety comes first. Guiding them and providing the walker balances both. While performing perineal care, the CNA should clean: A. From back to front. B. From front to back. C. In circular motion starting from the outside. D. In random order to save time. Answer: B. Cleaning front to back prevents transfer of bacteria from the rectum to the urethra, reducing infection risk. A resident with diabetes reports dizziness and sweating. What should the CNA do first? A. Offer water and return later. B. Report symptoms immediately to the nurse. C. Help the resident lie down and call security. D. Ignore since it may be anxiety. Answer: B. These are signs of hypoglycemia requiring prompt nursing evaluation. A CNA notices a fire in the kitchen. What is the correct first step using RACE protocol? A. Activate the fire alarm. B. Close all windows. C. Rescue residents in immediate danger. D. Extinguish the fire immediately. Answer: C. RACE equals rescue, alarm, contain, extinguish. Safety of residents always comes first. A resident with dementia accuses the CNA of stealing. The CNA should: A. Argue and defend themselves. B. Laugh it off in front of others. C. Stay calm and reassure the resident respectfully. D. Ignore the accusation. Answer: C. Dementia may cause confusion and false beliefs. Responding calmly preserves trust and dignity. When assisting a resident with ambulation using a gait belt, the CNA should hold the belt: A. From the back and lift upward. B. From the front with both hands pulling forward. C. From the side or back for better control. D. Not use hands, only verbal cues. Answer: C. Holding from the side or back ensures stability and prevents pulling the resident forward unsafely. A resident on oxygen via nasal cannula keeps removing it. The CNA should: A. Restrain the resident's hands. B. Replace it silently without telling anyone. C. Reapply gently and notify the nurse about noncompliance. D. Turn off oxygen to prevent misuse. Answer: C. Oxygen therapy is prescribed. Reporting noncompliance is essential for safety and care planning. If a resident falls but says they are fine, the CNA should: A. Help them up quickly. B. Leave them on the floor until family arrives. C. Stay with them and notify the nurse immediately. D. Move them back to bed without informing anyone. Answer: C. All falls must be reported. Moving the resident before evaluation may worsen injuries. A resident with COPD is short of breath after walking. The CNA should: A. Encourage rapid deep breaths. B. Help the resident into a high Fowler's position. C. Leave the resident alone for privacy. D. Immediately administer oxygen. Answer: B. Sitting upright eases breathing. Oxygen is administered only under nurse direction. A CNA finds a resident eating food brought from home that doesn't match dietary orders. The CNA should: A. Take the food away immediately. B. Allow them to finish for satisfaction. C. Report to the nurse for dietary safety review. D. Ignore since family provided it. Answer: C. Dietary restrictions protect health. Reporting ensures food safety compliance. A resident suddenly becomes unresponsive while eating. The CNA's first action is: A. Start chest compressions. B. Perform abdominal thrusts if choking is suspected. C. Call the family. D. Put the resident back in bed. Answer: B. Immediate abdominal thrusts, Heimlich, address choking emergencies. A CNA observes a resident hoarding medications in their drawer. The correct action is: A. Confront the resident directly. B. Report immediately to the nurse. C. Remove medications quietly without reporting. D. Ignore the behavior. Answer, B. Hoarding medication can be dangerous. Reporting ensures safe handling. When providing care for a resident on seizure precautions, the CNA should: A. Place padded side rails and keep the bed low. B. Hold the resident's tongue to prevent biting. C. Restrict fluids completely. D. Apply restraints during sleep. Answer, A. Padded rails and low bed minimize injury during seizures. A resident complains of new chest pain. The CNA should: A. Give them water and wait. B. Encourage walking to improve circulation. C. Notify the nurse immediately. D. Apply a cold compress. Answer, C. Chest pain may indicate a cardiac emergency. Prompt reporting is vital. While providing mouth care for an unconscious resident, the CNA should use: A. Toothbrush and toothpaste only. B. Swabs soaked in small amounts of fluid. C. A large cup of water to rinse. D. Flossing as in conscious patients. Answer, B. Swabs prevent aspiration by controlling fluid amounts in unconscious residents. If a resident with dementia wanders at night, the CNA should: A. Lock the resident in their room. B. Calmly redirect them to a safe activity or back to bed. C. Call the family immediately. D. Yell to stop wandering. Answer, B. Gentle redirection ensures safety without confrontation. A CNA finds two residents arguing loudly in the hallway. The CNA should: A. Physically separate them immediately. B. Call security without intervening. C. Calmly intervene and redirect both residents safely. D. Ignore the argument. Answer, C. CNAs should de-escalate conflict calmly and ensure safety. During catheter care, the CNA must clean: A. From the drainage bag toward the urethra. B. From the urethra outward along the catheter. C. Only the tubing, not the insertion site. D. Randomly to save time. Answer, B. Cleaning away from the urethra reduces infection risk. A resident's family insists on performing care tasks against facility policy. The CNA should: A. Allow them to avoid conflict. B. Stop them immediately and report to the nurse. C. Ignore as long as the resident is comfortable. D. Argue with them in front of the resident. Answer, B. Policies protect residents. Reporting ensures rules are followed respectfully. A CNA must measure a resident's pulse oximetry. Which is correct? A. Place probe on finger with nail polish on. B. Ensure the finger is clean, warm, and free of nail polish. C. Use the probe on any body part randomly. D. Apply probe tightly to prevent movement. Answer, B. Nail polish interferes with readings, warmth improves accuracy. A resident with limited mobility develops redness on their heel. The CNA should: A. Massage the heel to improve circulation. B. Place a pillow under the heel to relieve pressure. C. Ignore since redness is normal. D. Apply tight bandages. Answer, B. Redness is an early sign of pressure injury. Offloading pressure prevents worsening. A resident with dysphagia is on thickened liquids. The CNA should: A. Provide regular water when requested. B. Ensure all fluids are thickened as ordered. C. Allow family to bring thin liquids. D. Ignore the order if resident insists. Answer, B. Thickened fluids reduce aspiration risk. Orders must always be followed. A CNA is asked to obtain a sterile urine specimen. The CNA should: A. Collect urine from the catheter drainage bag. B. Use a clean catch from a urinal. C. Report to nurse since sterile collection is not CNA's role. D. Ask the family to assist. Answer, C. CNAs do not perform sterile specimen collection, this requires nurse involvement. A resident reports severe pain rated 9 out of 10. The CNA's responsibility is: A. Give prescribed pain medicine. B. Document the pain and notify the nurse. C. Tell the resident to wait until next shift. D. Apply heating pad without permission. Answer: B. Pain must be reported promptly to the nurse. CNAs cannot administer medications. A CNA notices a resident hiding uneaten food. The CNA should: A. Ignore to avoid embarrassment. B. Confront harshly. C. Report to nurse for dietary assessment. D. Take away food silently. Answer: C. Hiding food may indicate poor appetite or swallowing difficulty. Reporting ensures assessment. If a resident has a DNR, do not resuscitate, order and becomes pulseless, the CNA should: A. Start CPR immediately. B. Respect the DNR and notify the nurse at once. C. Call the family to ask permission. D. Do nothing at all. Answer: B. A DNR must be honored. The nurse must be notified immediately. When documenting care, the CNA should: A. Record tasks before performing them. B. Document only unusual events. C. Record promptly after care, with facts not opinions. D. Use personal abbreviations for speed. Answer: C. Accurate, factual, and timely documentation ensures continuity of care. A resident who is hard of hearing does not respond during care. The CNA should: A. Assume the resident is ignoring them. B. Speak clearly, slowly, and face the resident directly. C. Yell loudly to ensure understanding. D. Stop speaking altogether. Answer: B. Clear, slow speech with visual cues improves communication. While assisting a resident with feeding, the CNA must: A. Alternate food and fluids, offering small bites. B. Provide large portions to speed eating. C. Stand over the resident to control feeding. D. Avoid sitting near the resident. Answer: A. Small bites and alternating fluids improve swallowing and digestion. A CNA observes bruises in unusual areas of a resident's body. The best immediate step is: A. Ask the family about the bruises. B. Report suspicions to the nurse immediately. C. Ignore unless the resident complains. D. Confront the resident directly. Answer: B. Bruises in unusual locations may indicate abuse. Reporting is mandatory. A CNA is caring for a resident with advanced Alzheimer's who resists bathing. The best approach is: A. Force the bath quickly. B. Use calm reassurance and offer choices about time and method. C. Skip bathing indefinitely. D. Yell to gain cooperation. Answer: B. Residents with dementia respond better to calm reassurance and choices that respect dignity.